A 35-year-old man with asthma presents to your clinic for follow-up. He has wheezing almost every day. He's using his PRN albuterol inhaler 6 to 8 times a day, and he has no maintenance inhaler prescribed. Which of the following regimens would be most appropriate for his step up in asthma treatment? Is it budesonide formoterol alone, budesonide formoterol plus albuterol, budesonide formoterol and tiotropium, or all three of these inhalers? The answer will be A, budesonide formoterol alone. So let's first go over the classic inhaler rules in asthma. First, we have a reliever inhaler, which is only used as needed, when you get symptoms like wheezing or shortness of breath. And this is sometimes called a rescue inhaler. And this would most often be albuterol, which is a short-acting beta agonist. And then we have our maintenance inhaler, which is one that you would use every day, regardless of whether or not you're having symptoms. And this is really to get that baseline control. And in asthma, this would typically be an ICS, inhaled corticosteroid, plus minus a long-acting beta agonist. So generally, the approach to asthma treatment uses what's called a step-up algorithm. Now, we would adjust our inhaler therapy based on one's severity and control of their asthma symptoms. So on the left-hand side of this chart, if you have very infrequent symptoms, no prior exacerbations, we may start out only by prescribing an as-needed reliever inhaler. But if someone has very frequent symptoms, poor control, prior exacerbations, we would definitely need to add a maintenance inhaler on top of the rescue one for better baseline control. And it's important once you start someone on a step, you have to assess their response. And if they're still not doing well with their symptom control, you move on and step up to the next step. So for our patient who was only on a reliever, but still wheezing pretty much every day, this definitely warrants a step up by adding that maintenance inhaler. An exciting development in the treatment of asthma based on recent studies and as recommended in the recent Global Initiative for Asthma, or GINA guidelines, is what's called SMART, which stands for Single Maintenance and Reliever Therapy. With SMART, adults with asthma who would previously have to carry two inhalers, each to serve these two roles, the reliever and maintenance roles, now they would just use one inhaler, which is an ICS LABA combination with the long-acting beta agonist specifically being formoterol. And so let's explore the rationale and evidence behind SMART. First, the evidence. Um, when you compare patients on SMART versus the old standard maintenance inhaler plus using the as needed albuterol, patients on SMART have improved symptom control, decreased exacerbations, as well as decreased steroid exposure. Why might including an inhaled corticosteroid help to use as a reliever inhaler in asthma? Well, inhaled corticosteroids, they address the airway inflammation, which is the main underlying mechanism for why patients get symptoms. So whereas beta agonists don't. So it would make sense that using something anti-inflammatory when symptoms flare up would help patients feel better. And why specifically pick formoterol to be used in SMART? Formoterol is pretty cool in that it's both a long-acting beta agonist, so it has a long duration of effect, but it's also fast onset, so it can readily serve in that rescue role. Unfortunately, in the United States, there's still a huge implementation gap for SMART um, as of 2025. So, one of the big reasons is that there's a lack of FDA approval for ICS formoterol combination inhalers to be used as a reliever. So, because of this, many insurance plans do not cover this combination inhaler to be used as SMART. And so patients would end up having to pay out of pocket, which is very costly. In summary, SMART, which stands for single maintenance and reliever in therapy, is an ICS plus formoterol, which is a long-acting beta agonist. And when compared to standard maintenance inhalers, plus using as needed albuterol, patients on SMART have improved symptom control and also decreased exacerbations. But unfortunately, there's still significant barriers to prescribing SMART to patients in the United States with these factors, as shown here in the summary slide. So hopefully, in the near future, patients can soon receive this improved therapy.